Hi everyone, this is Casey Ulrich with the National Nursing Centers Consortium. I've begun recording our webinar and I want to introduce Kanae Durrell to set the stage for our webinar. Kanae, you have the stage.
Thank you, Casey. Hello everyone. My name is Kanae Durrell, and on behalf of the American Association of Nurse Practitioners and the National Nursing Centers Consortium, I would like to welcome you to today's webinar, which is an introduction to Quality Impact, the COSEHC Practice Transformation Network. Those of you who are unfamiliar with us, AANP and NNCC have joined in partnership to form a Nurse Practitioner Support and Alignment Network as a part of the Transforming Clinical Practices Initiative, and are working with practice transformation networks such as Quality Impact to enroll clinicians and their practices into the TCPI. Their clinicians will receive boots-on-the-ground technical assistance in the areas of quality improvement and practice transformation. During this webinar, you will be able to learn more about Quality Impact as a PTN, what they are offering clinicians, and ways to get involved. The information presented in this webinar, or its content and conclusions, are those of the presenters and should not be construed as the official position or policy of CMS or the U.S. government. Although this webinar is presented as a part of the TCPI, it does not necessarily reflect the opinion or position of CMS. Today's webinar is being recorded and will be available on our website in the next week and at www.healthcarecommunities.org under the Nurse Practitioner Support and Alignment Network. If you haven't already done so, please feel free to browse this website and join our NPSAN. All participants will be muted throughout the presentation. I encourage you to submit questions throughout the presentation. Please use the Questions tab on your GoToWebinar control panel as seen to ask your questions. It will be relayed to the presenters and answered at the appropriate time. Before I introduce you to our presenters from the Quality Impact PTN, I would like to give you a brief overview of the TCPI and the Nurse Practitioner Support and Alignment Network's role in this work. The Transforming Clinical Practices Initiative is one of the largest ever federally funded initiatives to support practice transformation through collaborative and peer-based quality improvement. Next slide, please. Our TCPI is structured by bringing practice transformation networks, which are peer-based learning networks, and support and alignment networks, which are professional associations and other healthcare organizations together to support clinicians and enroll them into the TCPI. Next slide, please. Next slide. The SANs will work in concert with the PTNs to ensure that PTNs have the resources and the tools that they need to support practice transformation, and will also will make sure that clinicians are aware of the TCPI, its importance, and how they can become involved. Next slide. The goals of our NPSAN are to raise awareness of the TCPI amongst NPs, recruit NPs into the PTNs, provide PTNs with NP-specific CE content and resources to support their engagement within the TCPI, to also develop TCPI-related content specifically for the nurse practitioner community, and ensure that NPs can thrive in a pay-for-performance world. Next slide, please. If you're interested in participating in the TCPI or joining our Nurse Practitioner Support and Alignment Network, please do not hesitate to contact NNCC or AANP to learn more. And we can help you identify a PTN that can support your practice. You can reach out to myself at cdurrell@nncc.us or Chantel DePape, which is also listed here on this slide. You can also go to our NPSAN landing page, which is at www.aanp.org/practice/NP-SAN to learn more about how we are supporting nurse practitioners in this initiative. You can also join our NPSAN page at the Healthcare Communities website. And I'm going to pass this on to our presenters and allow them to introduce themselves from Quality Impact, the COSEHC Practice Transformation Network.
Great, thank you, Kanae.
This is Anna Thomas. I'm the Assistant Director of Quality Impact, the COSEHC Practice Transformation Network, and it's my pleasure to join all of you today to share a little bit more about our partnership with these organizations and also our ability to support the great work that you're already doing in helping you to transition to a new value-based delivery system. I'm joined by one of my colleagues today, Dr. Bill Besterman. He is the Medical Director for our PTN, and we'll be sharing a little bit more about ourselves with you, what we're offering as a transformation package, and then a little bit more about how we think we can assist each of you individually based on your individual practice nuances and really transitioning down this value-based road. So with that, I think I'll pass the advancing of the slides to my colleagues over at AANP and NNCC. Over to the next slide. Great. Just a little bit more background here about CMS's overarching goals with TCPI. I think Kane stated many of them at a high level, but I just wanted to reinforce for the group today that, certainly there is a huge effort underway utilizing PTNs, SANs, and other organizations that are aligned with physician and nurse practitioner practices to really understand how we can help transition through this journey toward value-based care from fee-for-service really to alternative payment models in the coming years. And on the next slide, you'll see that a cornerstone of that is the recent macro legislation that was recently instituted. I think, it goes without saying that there are numerous changes that we'll be anticipating down this road, and what we're really informed and able to do is help you all in your practices really understand what that legislation means for you. As part of our PTN, also enable you with specific support resources and tools to traverse that with ease, and also make sure that you're really positioned for success and versus reacting to the new legislation. As mentioned, we're really here to provide guidance and support through phases of transformation. What you see here on your screen are CMS's defined phases of transformation. And as you'll see, it really begins at the foundational level in setting aims, setting goals really for transformation, and progresses all the way to the right where you can really be successful. And so it's part of our duty as a PTN to appreciate that every single practice is in a different space within this transformation spectrum, and that what we're going to be doing, and I'll share in just a moment, is providing and aligning ourselves with the right tools and support to help you, again, go from left to right. So our name is Quality Impact. Again, we are funded by CMS to provide our PTN change package at no cost to all of you and to your associated provider groups. Our target goal is to involve 3,400 providers in their efforts to transform their practices to these new care models. And really our focus has been primarily on the southeastern U.S. We will have 4 years to provide these transitional support resources, and I've been very excited and encouraged to see really the broad range of types and sizes of practices that have already signed on with our network. I'll share just a little bit more about our organization. As indicated here on the screen, there are actually 3 different organizations that comprise our PTN. We are a partnership. Starting on the left-hand side, you'll see the Consortium for Southeastern Hypertension Control. This is an organization that is the lead on our grant application, and they have extensive experience over the last 20 and 30 years really looking at how to improve clinical quality at a practice level, and doing that through clinical education, physician leadership, and really understanding how the application of data and transparency can drive some of those results. The organization that I represent, the second partner, is called the Group Practice Forum, and we're a care delivery consulting firm. We're differentiated for sure by many consulting firms in that we're quite granular, and we also try to be very practical. We care really as much as the how of getting the work done as we do about what it should be. So really focusing on our work with practices, rolling up our sleeves, understanding their particular nuances and how we can support their efforts. And using, looking at how we can improve processes, how we can incorporate people in a meaningful way to leverage the resources that already exist at a practice to make that type of workflow optimization achievable. And then the third partner is Symphony Performance Health Analytics. They are a technology and a data company and really have been a leader in the field of providing actionable analytics that really help providers and their associated care teams take action on patients one at a time. I'll share with you in just a moment a little bit more specific software offering, but they have tremendous experience in this realm and really try to create for providers a tool that's extremely user-friendly, very specific to their needs and opportunities in working with patients and improving population health, and also working with them in a way that can take into account not only claims data, but really integrate the rest of the different data sources in a practice environment to create a more holistic picture of the patient. At this point, I'd like to share a little bit more about our extended team beyond the individuals that you're hearing from today on the phone. We do have a whole team of practice facilitators that we assign to our practices as they are signed on with our PTN, and then also a really tremendous group of advisors. The individuals that you see on your screen here, in addition to Dr. Besterman, are really instrumental for us in the implementation of clinical protocols when appropriate, design of clinical education, and really how that looks from an implementation standpoint in a practice environment. These are individuals that are not only exceptional from a clinical expertise perspective, but they really get it. They're very operational in nature as well. And each of them also boasts a really terrific subcommittee of a particular chronic disease area focus. So it allows us to not only gain their insight, but also drive the right type of activity around these specific chronic conditions to help achieve some really good outcomes and cost results. Before I move on to the next slide, I would like to officially introduce Dr. Besterman and ask that he provide just a few more words about this group of individuals.
Yeah, can you hear me, Anna?
Yes, I can.
Okay. Well, I think the advisory board that we put together is exceptional. Dr. Rochella in the lower right was the head of the high blood pressure education program at the National Heart, Lung, and Blood Institute. And what that really meant was he supervised the development of hypertension guidelines 1 through 7. So up until the last hypertension guideline, he helped bring all the different parties to consensus on what those guidelines should look like. And he's got a very deep knowledge and practical view about how we should proceed for improvement. And then Dr. Carey has been Dean of the University of Virginia Medical School. He's an endocrinologist with a cardiovascular subspecialty interest. And he, again, is very practical. He was one of the main authors on the resistant hypertension article, the landmark resistant hypertension article in Circulation. And then the rest of us are clinicians with deep experience in the particular subject area. So I think it's a very practical advisory board with a lot of strength.
Great.
And with that,
Thank you,
I'll
Dr.
ask
Besterman.
to go on to the next slide.
Great. I'd like to provide just a words here, and then I'll pass the stick back over to Dr. Besterman for a couple of moments. I wanted to just mention the fact that we have, this is not the first time that we have all worked in concert with one another. Our 3 partners, most recently over the past 3 years, worked together in an arrangement with Blue Cross of Louisiana as they were really diving into their first foray into a quality improvement program. And we provided the expertise not only clinically from the COSEHC perspective, but then also applied our people and process expertise at Group Practice Forum, and then the clinical data component through SPHA to really combine this almost trifecta, if you will, of all of the drivers that we've seen be really effective in transforming care. And as you see here, as indicated on the screen, there are a couple of builds if you click through. But you'll notice that we were very excited to see that there were some very significant clinical results that were reaped in just the first year and a half and 2 years of the program. And then more exciting even was the handsome byproduct of a net savings to the tune of $25 per member per month. And I think it's evident by the fact that we combined those three elements in a way that was meaningful to the providers. We created the right structure to really support their existing efforts, not create more work for them, and really focus on the right drivers to improve clinical care. Dr. Besterman, would you like to add to that?
Sure. That $25 per member per month was net, and it turned out to be tens of millions of dollars beyond the cost of the program. The other thing that's important is with many of these improvement issues, you have improvement for a while and then the results begin to deteriorate. We just celebrated our 3rd anniversary, and all of these 4 clinical suites continue to improve, and the improvements have been very robust. So if you look at hypertension, for example, when we started with 650 providers, the control rate on average was 47%. Our most recent analysis showed that it is 64%. As far as I know, in 650 providers scattered across the state, that's the most robust change in clinical performance that I know of. Now, closed systems like Kaiser Permanente have done it, but to do it across the state in diverse clinical practices, as far as I know, that's pretty much unprecedented. And then the other 4 clinical suites improved to the same level as well. So actually, we're talking about practice transformation networks, and we're looking to really improve care and save money. And we've actually shown over a 3-year period that we are a practice transformation network that is high functioning. So I'll pass it back to you, Anna.
Great, thank you. If we move forward a bit, after you see some of those numbers pop up on the next slide, I wanted to share a little bit more about what it is that we're offering. What is our transformation package? Again, this is offered at no cost to our participating practices and is really grounded in 3 key principles that we have seen be necessary for sustainable transformation. The first is an element, again, of practicality. We've mentioned that a couple of times, but I think it's particularly important because it is an element that, if gone unnoticed or untapped, really doesn't allow you to understand how you can work within the existing constraints or opportunities of a practice in a way that really understands and appreciates the existing culture, the existing operations, the existing structure. So for us, practicality is really key. What is the work that you can get done tomorrow in a reasonable way? And then how can you incrementally build on that over time? The second is making sure that we, once again, are not disruptive to the providers and their care teams. It's very critical for us that we put in place plans when we work with our practices to make sure that they feel supported by this effort and not drawn down by it. So we're making every effort through our transformation package to make sure that we are enabling that administrative burden that's ever mounting with providers to be mitigated through the use of our technology, through the use of new processes and new or existing resources that can be deployed in a different way. And then finally, that same idea of efficiency, making sure that we can allow our practice to run as smoothly as possible and look at some interesting ways of how perhaps we can reorganize what already exists in a way that can be more productive, realizing that many provider groups certainly don't have the capacity or wherewithal to bring on several new full-time employees. It's really key for us to get creative and really understand how we can make the best use of what exists currently and then make a plan for the future. So the PTN resources that we are providing are 4-fold. The first is the MD Insight Population Health IT solution, as indicated on the top left. And that really, again, is the catalyst for a lot of the work that we do. The Symphony Performance Health tool, MD Insight, is really tremendous, not only in its usability and applicability in a practice environment, but also because it paints a really comprehensive picture of the patient profile rather, based on disparate data sources that exist today. I'll provide a little bit more information about MD Insight in a moment, but essentially it creates a springboard for us to understand what are the key clinical gaps that we can help reinforce with the practice over time, patient by patient, and then week by week. The second component of our transformation package is grounded in what we will do initially, which is an assessment with each of our practices to really understand what transformation phase they are in at a given point, and what's the roadmap and action plan that we can put into place that is very customized to that individual practice and can help them meet their transformation needs down the road. Again, we appreciate that the unique culture and operations of a practice as well as their current clinical practice are all really key components of understanding how we can appropriately support that effort. Our transformation package is very customized, and again, there's no element of off-the-shelfness because we appreciate that that's very hard to do when you've seen one practice and you've seen one practice. So what we'll do as a result of that assessment is not only, again, understand where a practice is in their transformation phase, but align that to the individual goals of the practice. Are there particular initiatives that you've been trying to get off the ground that perhaps you haven't been able to? Or are there certain initiatives that you feel like could be working better? Those are all areas where we can help you improve. We're also very interested in aligning with existing and prospective payment models. As we mentioned, with MACRA on the horizon in a very near sense, we want to really allow practices to not only protect their existing revenue, but proactively enhance that as this journey moves forward. That includes things such as CMS initiatives like the annual wellness visit or chronic care management series. Those are areas where we can provide facilitation support by our team and resources and tools to actually get that work done. And also really take a lens of looking less at patient lists or silos of patients and looking across the populations and understanding how we can help them improve, which means two things for our constituent practices. First of all, it means that we're looking at a holistic population health approach, which we believe in very, very strongly. And then secondly is the opportunity to help all boats rise across your different payment models so that once again, you don't have to look at your Blue Cross patients, your Medicare patients, et cetera, and look at them in different silos. You can really break those down and start to understand how can we win overall because we know it's the right thing for these patients. And then finally, a terrific opportunity that's realized through the PTN is that itself, it's the network effect. And through our PTN, we're going to provide numerous opportunities, both on-site and remote, for practices to connect with one another, not only in their local, state area, but also more on a broader regional basis and even nationally, as we have the opportunity with CMS to identify those who are doing really neat things and should be sharing with others. We'll provide our practices not only with a chance to learn from each other what's working, what's not, and how you can help each other improve based on what you learn, but also really provide you with this national stage at a CMS level to get the deserved attention that you should receive as a result of all of your great work. On the next slide, I'll share for just a moment a little bit more about the MD Insight tool, again, as a cornerstone of our program. What you see here is a depiction of just one screenshot of the tool. This happens to be the patient care summary. This is the drill down view, and as you see, it's quite granular. Again, the rationale for the tool is instead of looking at outdated claims data or just at a documentation source such as your EHR, the opportunity to bring that together and create a 360-degree view of your patient really allows you to do some really neat work from a population standpoint and also activated for the patients that might have upcoming appointments next week or need appointments to be scheduled. So the tool itself integrates not only clinical EHR data, claims data, and practice management data, but also other data sources such as labs. It is a cloud-based tool. It is not meant to replace an EHR by any means. It's a very important documentation resource, but rather it acts as a population health platform to start to, as indicated here, highlight some actionable opportunities that you can use to improve your patient's care. You'll notice the different colors that call out specific actions that may be required or incompliances with your different patients. And through the integration of the practice management data source, there are also some really neat capabilities in terms of how you can isolate patients with upcoming appointments, let's say in the next week, that have specific care gaps, so that might be flagged as, quote, high risk. So again, it also acts as a facilitator of new workflows to support that type of population health management work that we all know is really important for our patients. Finally, it's very much aligned to all of the latest and greatest standards, including PQRS and HEDIS. So for the practices that ask the question of, well, how will I know if I'm improving in these different domains? The Symphony Performance Health Analytics team really takes great care in making sure that they are already aligned with those measures. So you can utilize the platform as your one-stop shop. And then finally, from a technology perspective, the company does have significant expertise working with a number of different EHR vendors and a number of different constructs. So there's the opportunity for all of you who might be wondering, does my EHR platform allow interoperability with a tool like this, to pursue that conversation. And then finally, as I move on to the next slide, I wanted to highlight that there is this granular patient view, but you can also zoom out and start to look at segments of your population. As you'll see here, these are some of the clinical suites. Think of them as patient registries, by which you can really slice and dice your patient population and start to create more of a campaign approach, if you will, to delivering proactive versus reactive care to, let's say, your adult hypertensive patients. A lot of times we'll work with a practice who, quite frankly, is just really excited that they're able to see who those patients are in a registry function for the first time. But for those of you who are already utilizing disease registries, the tool also offers numerous opportunities to, again, intersect with the clinical and the claims data, that practice management information that really helps create a more actionable plan around what do you do next now that you know who those patients are. As a PTN, we are also very aligned to specific metrics that for us will demonstrate our success. We're accountable to CMS for the measures that you see on your screen here. We're big proponents of transparency, so we wanted to share this with the group on the phone today. Just, if nothing else, for your background knowledge, these are areas that we're looking to improve across our PTN, not necessarily practice by practice. And unsurprisingly, you'll see they're focused on a number of chronic disease areas as well as resource utilization. Our focus is on quality. Our focus is on population health. But as such, we know that if we deliver the right type of care in that construct, we'll be able to improve our resource utilization as well. And then finally, before I move forward and open it up to some questions, I wanted to just mention a couple of other elements of our program that we think are really critical. The first is this element of making sure that we can enable our providers to do the best work possible, to really bring back the joy of medicine. And in doing that, we want to make sure that provider satisfaction is a cornerstone of all that we do, where we can minimize an existing burden, where we can help provide infrastructure or support to help our providers do that we know they love to do and why they got into medicine in the first place. That's really a goal for us. To that end, practices who do engage with our PTN on a provider-by-provider basis will receive a nominal practice engagement incentive. Essentially, that is something that we're providing to practices in compensation really for them spending time with us to collaborate initially as we get started and start to appreciate the process that we're going to be moving forward with together. In terms of eligibility, I think it was already stated earlier in the webinar, but in addition to nurse practitioners, physician assistants, as well as primary care physicians and specialists are eligible. We're very excited that it's a more comprehensive group, and it's not just the PCPs or the specialists of the world. And we are also hoping, based on the use of the MD Insight tool, that the practices who are interested in joining us have an EHR. We do have some workarounds for those of you who might not have an EHR, but it certainly creates a more activated use of the MD Insight tool. And then finally, I just wanted to add once again that these resources and services are free. We really look forward to rolling up our sleeves and working with all of your groups, I hope, to really understand, again, where you are today, where you hope to be tomorrow, and how we can help to alleviate some of that heavy lifting that you see on the horizon. before I close it out for questions, I would like to ask Dr. Besterman if he'd like to close with any parting words.
Okay, well, I just did want to go back to this data tool and just say that one of the things we've done at the 3-year mark with these practices in Louisiana is go back and interview them about what they found most helpful. And that population health tool was one of the things that really helped them improve to that very significant degree that I quoted earlier. And so they can see at a glance whose blood pressure isn't under control, whose A1C isn't under control, who hasn't had a visit. And they use this information in a very practical way to focus on the patients who are higher risk and who are going to be higher cost. And so every piece of this program is like that. I would like to add that many programs have had pieces and parts of the quality improvement puzzle, but what makes us different, I think, is we have brought together a comprehensive solution. So what we've tried to do is actually implement what was recommended in Crossing the Quality Chasm by the Institute of Medicine, developing evidence-based care processes, great teaching tools, data management tools, and encouraging the right kind of payment models. And so we really look forward to working with you guys, and we'll try to stay out of your way and make it as practical as we can.
Thank you, Dr. Besterman. And in closing, as we transition over, I wanted to just finally mention that for those of you who might be interested in learning more about us, and you have additional members of your team that might want to get in touch, you'll see my email there is on the screen. We'd be happy to set up a separate webinar addressing any questions you might have around the adoption of the technology, the facilitation that our team will provide on-site and remote, and so forth. And we can also walk you through our implementation process as well. But wanted to reserve some time for questions. Thank you so much for listening today.
Thank you very much, Anna. Again, if you have any questions for our presenters, you can raise your hand, submit something through the question box, or something through the chat function. Right now we have no questions in the queue. While we are giving folks a few more minutes to put something in, please be aware that there will be a short evaluation when we end the webinar today, and filling out that evaluation will help us refine our services and make sure that we are providing supportive services for clinicians going forward. So please take a moment to do that. And again, a recording of today's webinar will be live and available within the next week, and that link will be shared with our registrants. All right, we still have...
Casey, if I may, I'd love...
Go ahead.
Oh, I'm sorry. I was just going to say I'd love to just provide or use the opportunity to also extend to folks on the line today that a really great opportunity through our PTN has been and continues to be our collaboration with organizations like these today. There's a great deal of collaboration that's taking place, and a lot of the work that we'll be doing moving forward is really dependent on that. We are very actively seeking and integrating resources that organizations such as these two here today can provide, and really hope to bring the best of the best to our constituents who are in our PTN.
Thank you very much, Anna. Yeah, and speaking about that collaboration, if you have questions about, this PTN or any other network that's operating, for those of you who may not be in the southeastern United States, we can help connect you to other networks that are active in other regions across the country. So it doesn't look like we have any questions at this time, so Anna, if you have anything else you'd like to, any other comments before we shut things down?
No, just thank you everyone again for your time, and I really hope that you'll reach out if you're interested in receiving more information. Thanks for your time today.
Thank you, everyone.